Imagine struggling with severe sleep apnea, trying every common solution, but still waking up gasping for air, feeling completely exhausted. For most people, managing sleep apnea involves options like CPAP therapy or continuous positive airway pressure, and sometimes lifestyle changes or other minor surgeries. But what happens when those simply aren't enough to provide relief or maintain health? A tracheostomy for sleep apnea is considered for individuals with extreme, life-threatening obstructive sleep apnea that has not responded to all other available treatments. It is a last resort procedure for a very specific and severe set of circumstances. This procedure creates a direct airway, bypassing any obstructions in the upper respiratory tract. The primary reason a tracheostomy becomes a consideration is when the upper airway obstruction is so severe and persistent that it poses a significant and immediate threat to life, or causes debilitating health issues that cannot be managed by less invasive means. Patients might have complex anatomical issues, severe obesity, or neuromuscular conditions that make their airway impossible to open during sleep, even with maximum CPAP pressure or after multiple other surgeries. The goal is to provide an unobstructed breathing pathway, ensuring oxygen flow and eliminating apnea events entirely. If you or a loved one are facing such a challenging situation, the path to considering a tracheostomy involves a comprehensive evaluation by a team of specialists. This team typically includes a sleep medicine doctor, an ear, nose, and throat surgeon, and sometimes other experts. They will thoroughly review your medical history, sleep study results, and the outcomes of all previous treatments. They might recommend further imaging or diagnostic tests to precisely locate and understand the nature of the obstruction. The decision is never made lightly and always prioritizes patient safety and quality of life, focusing on whether this highly effective, yet invasive, solution is truly necessary. This procedure provides a permanent solution to upper airway obstruction by creating a stoma, which is an opening directly into the trachea or windpipe, usually at the neck. A tube is then inserted into this opening, allowing air to bypass the nose, mouth, and throat during sleep. During the day, the tube can often be capped or removed, allowing normal breathing, while at night it is open to ensure unrestricted airflow. This ensures complete elimination of airway obstruction during sleep, which is something very few other treatments can achieve with such certainty. Ultimately, the consideration for a tracheostomy represents a commitment to overcoming the most severe forms of sleep apnea, allowing individuals to breathe freely and achieve restorative sleep. It is about regaining control over one's breathing and health when all other avenues have been exhausted, paving the way for a safer, healthier future, free from the life-threatening pauses in breathing that severe sleep apnea imposes.